Demonstrating the repair of damaged articular cartilage in the knee using biocartilage extracellular matrix. This technique is used to repair the smooth, eggshell-type tissue that covers the ends of the bones, also known as articular cartilage. It helps the bones to easily glide over each other. Biocartilage extracellular matrix is developed from allograft articular cartilage taken from sterile donor tissue and meant to serve as a framework for the body to create new, healthy cartilage. In this procedure, the surgeon makes the surface even and multiple small holes are drilled in the bone to help promote the healing process. After it is dry, the surgeon uses a delivery needle to place the biocartilage onto the surface. A curved instrument is used to smooth out the biocartilage to the cartilage around it. Then a thin, light layer of natural fibrin glue is placed over the biocartilage to complete the procedure. Biocartilage may help to create new articular cartilage by promoting the best environment for healing.